Hello, Henry County. I'm Melissa Robinson, Communications Director for Henry County Government. Welcome to Henry Talks. And today we're sitting down with our chair, Carlotta Harrell. Welcome, Chair.
Thank you.
And also Chelsea Folds, the Executive Director of Hands of Hope Clinic in Stockbridge, correct?
Yes, that is correct. Thanks for having me.
Thank you for being here. I know it was a little haul over from Stockbridge, but we're happy to have you.
Thank you so much.
So let's just get into this conversation because there's a couple of things we're going to talk about. And the first thing is, I know what Hands of Hope is, and so many do, but as the county grows, maybe some people don't, and you do an amazing job. So can you tell us a little bit about Hands of Hope? And I'll get to Chair's opinion of all of that, but just tell us about what you do and so people know what you offer.
Yeah, absolutely. Hands of Hope Clinic is the county's only free and charitable health clinic. We do medical care, dental care, and mental health care. Mm-hmm. Those are our three main programs. Everything that we do is for Henry County residents who are uninsured, so no Medicaid, no Medicare, no private insurance, and who are low to moderate income. Okay. And so our patients come to us and we can give them a full-scale medical facility. We like to be their healthcare home, where they call us home. We're their primary care facility, and we've been doing it now in the county for over 20 years.
Right. So I have to plug 2024 was your 20th anniversary.
That is correct. We've been here 20 years.
And so when people, so it's clear, when people come for your services and they meet that criteria, they don't have a copay, they don't have additional costs associated?
So it kind of depends. There are different programs with different requirements. For the most part, it is a low cost fee, so a flat fee of $10 will usually get you your dental appointment or your medical appointment. Mental health care currently is free of charge, and those small fees just help us with the administrative costs of providing the care.
Well, Chair, there's nowhere you can go in Henry County and get a $10 dentist appointment, right? Because you've known about Hands of Hope forever, so.
Absolutely. I remember Hands of Hope when Janet Turner first started Hands of Hope 20 years
ago. Yeah.
Right, absolutely. And so I remember her going around, promoting this, and I was just like, really? So Hands of Hope, I mean, my copayment is more than $10.
I
know. That is really, affordable for people that don't have any type of health insurance coverage to be able to go and see a doctor or get dental services for $10.
Just can't beat that. And our copay is one thing, but then our insurance covers a lot more, and so you really are a great asset to this county with what you're doing. But you say that you can handle more.
We certainly can. Okay. So Henry County, as we all know, is just growing by leaps and bounds, and the population is increasing. And with that are individuals who may not know that we're in the community and could utilize our services. Many of our patients are individuals who are working, maybe have part-time, or their work just doesn't quite get them enough hours to have coverage, and so we're seeing a lot of those individuals that come in and they're able to afford really quality care, and not just the primary care, but we have a lot of specialty care that we can refer patients to and that we have on site. We have cardiology, we have orthopedics, we have women's specialty clinics, we have eye clinics, we have mammograms. So we're doing a lot of really great work. This year we have expanded our dental program a good deal. So not only are we doing hygiene, but we're able to do crowns and bridges and dentures. So those are new things that we're able to do. And our mental health care program. So that has been a huge need, and we want to be able to help the whole person. Right. When you have one thing going on, you got several things going on. And so we're there trying to offer that care in a one-stop shop.
I think that's great. I know for Chair Harrell, mental wellness has been kind of part of your platform. You've been in many summits, organizations, you've formed some different things, making sure that people have access to that care, for mental illness and for even within our community, people who are indigent. So talk a little bit about that, how the importance of that is.
Well, one of the things that our former president of ACCG, which is the Association of County Commissioners of Government. We signed a resolution, all 159 counties signed a resolution with regards to expanding and funding mental health services. And so because of a lot of the closures,
Right.
the accessibility to mental health services and even health care in certain areas around the state are very minimal. And so it is important that we're able to provide the mental health services that our community needs to address needs. I mean, we have a lot of our youth are going through different challenges, since the pandemic and returning from COVID, just trying to readjust to society as a whole. And so we just want to make sure that anyone in our community that need mental health services have accessibility to those services.
So important. Such great work you do. But I want to go to a couple of figures I saw, and I know they maybe need to be updated, but I saw that you have served over 6,000 individuals in over 30,000 visits.
Yes. Since our beginning, and like I said, we probably need to update that, but we are doing everything we can to be there for the community, as we were talking about, as population rises and the need expands. We're keeping our eye out on different legislation and things like that. If we are to lose some Medicaid funding, would those patients be coming to us? Different things like that to be prepared for the need of the county. So last year, in value of services alone, from being able to see our patients to the medications to free imaging and lab work with our partner with Piedmont Henry Hospital, we were able to give $2 million worth of care to Henry County patients, and that it's significant. It's a significant thing that we're able to provide, and we just want more people to know that we're here and that we want them to take advantage of these services. One of our biggest goals is, we are located, for those that don't know, on the campus of Piedmont Henry Hospital, and one of our top goals is to keep individuals out of the ER. So many individuals go to the ER for their primary care needs, and then those with actual emergencies, the wait list gets long. I believe Henry County is the most used hospital. I think like 100,000 people are coming through through their ER, and so one of our big goals is to be able to let people know that we are an access point to their care. So if they have, if they need insulin, or if they have a cold or something like that, let's not go to the ER, but let's go to Hands of Hope, get your primary care and all those kind of needs fulfilled there.
Definitely. I remember, Chair, during the pandemic, we had to issue something out of our emergency services because people were using the ER for things that could have been handled by a doctor or a televisit. And so we remember that very well, that, the ER gets stopped up, and then people who are having true emergencies, you might have to wait, and they try to prioritize. But
Exactly.
I think that's such a good reason.
Yeah, I think the role that Hands of Hope plays in our community is key, and it's about letting our community, making them aware of the services that are offered, because yes, a lot of times things that are just preventative care turn into chronic care.
Right.
And so you can start off with something as simple as a cold or the flu, and you're not getting any type of treatment, and then if it worsens, it can turn into pneumonia or other things, and then you end up in the emergency room. And so a lot of times the preventative care being provided to individuals, I think, can help with a lot of the issues that we're having in the emergency room. The Piedmont Henry Hospital, since it became a trauma hospital, and since the closure of Atlanta Medical in Atlanta, we are seeing a huge increase in the emergency room because those individuals are now coming to Piedmont Henry. And so we have the ability, with the assistance of Hands of Hope being in the community, to try to give the emergency room some type of relief.
So what better way to promote this than to have, I mean, you've been helping people for so many years and getting the word out, and long partnership with the county, but for the last 4 years you've been doing this Kicking It Kickball charitable, give me the name of it.
Yes,
again,
it's
sorry.
Kicking It, kicking healthcare inequities to the curb.
Okay,
It's
all right,
it's
good.
our
It's a
main
lot.
fundraiser of the year. I know it's a big mouthful.
It's okay.
But ultimately, you know, we
Yes.
want everyone to have quality to access. Quality to accessible
Right.
healthcare, and to do that, one of our ways is through fundraising. We do a lot. We're funded through grants and through the county's a good partner, and of course through individuals in the community. But we have this big event coming up on October 18th, our Kicking It kickball tournament fundraiser, and Chair Harrell has just been wonderful as we've continued to try and grow that every year over the last 4 years, and so it's coming up. It's coming up soon.
I knew you were in on this from 4 years ago, and I remember the first thought was, how many people my age are going to get out there and pull a hammy because they're trying to play kickball? But I will not be doing that, but I will definitely be there to support. So, Cheryl, tell me about the Kicking It. I'm not going to say the whole name.
Yeah,
but Kicking
it's
It
fine.
Charitable
Kicking
Healthcare. I know it's big for you, and you want to make sure that people know about it and participate.
Right. So, you know, when I was asked at the time by Amanda Reeves, who was the executive director during that time, she came up with this idea to have this kickball tournament and to have teams. And so we solicit different businesses to have teams, and of course, Henry County government has a team.
All right.
And it's very competitive. The sheriff's office has a team, and
okay.
the
Very
water
competitive.
authority, and
Oh
then
my
I mean,
gosh.
and they are really serious
They
about this
are.
kickball. And then we have a lot of our business communities that take part in it as well, and so. You know, we're just encouraging everyone
Right.
to consider, you know, formulating a team and coming out and joining the fun. But this is for a good cause.
great cause,
This is
yeah.
for a great cause to help raise funds to continue to be able to provide those medical services
definitely
to our
is.
community.
And it's a
Yeah.
fun day. It's a fun day of
It's a fun day.
exercise.
Yes.
So you're still looking for teams. You're still looking
Yes.
for 12-member teams.
12-member teams.
Okay.
Yep. We have 16 team slots available
great.
and double elimination. Apparently that's a thing, you know, kickball. But yes, we're looking for some more teams to get involved. Like Chair said, some of these teams really get into it. They have their shirts, and they
I wanna
practice
say, yeah.
over throughout the
I-
year,
Yeah.
and
Oh,
it's
yeah.
really great. It's
You
great
have
fun. It's a really good team builder
Right.
for a lot of these companies that have their employees that come out and do it. But yeah, so looking for some teams. We're looking for sponsorships,
Good, great.
and even vendors. We have vendors that come out and are able to showcase what they're doing.
So it's more of it's a really celebration atmosphere.
Yeah,
Raises
it
money.
is. Very
I remember
community.
from maybe last year or the year before the pictures, and some of these teams get really crazy with their costumes or outfits, and they're all out there
yes.
for display. So,
yes.
and
Oh,
I know
yes.
you love to point them out when you're out there and welcoming everyone. I remember that. So, I think it's a wonderful day to celebrate, and it's on a Saturday, right?
It's on
So
a Saturday.
you
Yeah.
have the whole day to kick the ball
Kick the
and
ball and
be doubly eliminated.
yeah, be doubly eliminated.
So that's great. I think it's wonderful. So if somebody wants more information about the Kicking It Kickball charity, all that good stuff.
Fundraiser.
Fundraiser.
Yes.
How they can find out
So
about
they
that.
can go to our website, which is just handsofhopeclinic.org, and you can see it right there. You can sign up on our website, and then also you can see it on our Facebook, and we're sending out to the community in different ways. So
And we're going to we'll share it.
Yes,
We're
absolutely.
involved. Cher, do you have a favorite for this year who might win? Do you Are you going to endorse anybody? Because I think you have a few teams from the county who are
That's
going to be
right.
competing, so you might not want to play favorites, but
Yeah,
Don't
we'll
say
just
it.
see.
Don't
We'll
say
just
it.
see. We'll just see what happens.
Can't
We'll
have
just see.
favorites.
I think last year, didn't Southern Grace win it last year?
They were I think a runner up. So Water Authority has won 2 years in a row.
Oh yeah, the Water
The
Authority.
Water
Oh yeah,
Authority.
Tony Cornell takes this
Yes.
really seriously,
does.
really
He
seriously.
does.
But I know that it's very competitive, but we have
fun.
a lot of fun,
Yeah.
and so we just want people to come out and support, to donate to Hands of Hope, to help us to just continue to be able to provide this medical service for those that don't have insurance.
it's really an incredible service. You're right about that. So if somebody needs help and they're looking to, they're not insured, they meet the criteria, what's
Certainly.
the best way? How do they start conversating with you? Or what
Yeah,
do they do?
absolutely. So a couple different ways. They can, of course, call the clinic. We're open 9 to 5, Monday through Friday. So you can call us there. Shall I say the number?
We
Or
can
will-
put it on the
Okay.
website. Put it out there.
And then also just going to our website, there is a specific place for prospective patients, and they can go fill out. There's an application process that we've recently redone and making it even easier to become a patient. And it's a pretty simple process. So just give us a call. That's your first step, and we'll get you an appointment.
I think that's great because, you know,
Yeah.
when you're not feeling well or if you're chronically
Yeah,
ill,
you're.
filling out forms can be just
It can be a
super
lot.
chore that you can't even finish. So I think it's great that you're making it easy. for
Yeah.
people. Well, we support you. I know the chair does, the county does. We hope that it's a magnificent time of fundraising and kicking. And Chair, I'm sure, will be out there to give her words of wisdom and cheer on her favorites.
Absolutely.
They are,
Yes,
but-
and we couldn't thank her enough for all she does for the
Yeah,
clinic.
it's
Yeah.
great.
And you know, Chelsea, I think one of the things that we left out was the doctors
Absolutely.
that provide.
That is a big
this-
part. We don't
yes.
want to let them go without getting many praises. So the way that we're able to do a lot of what we can do is through volunteers from the community. So physicians, nurse practitioners, nurses. We have students that come in, and through that volunteerism, we're able to provide the good work that we do.
I mean, that's such a benefit to have
Yeah.
physicians who are willing to give of their time to help
Exactly.
you. I mean,
That's
that's
It's a
incredible.
big thing.
It really is.
Yeah.
Dentists, I guess, too. And
Yeah,
all of
absolutely.
that. So
All of it.
That's, yeah, I mean, kudos to them and they're just
Yes.
making things better. So
Yeah.
that is a big deal. I'm glad you mentioned it.
Thank you for bringing that up.
Yes. All right. Anything else we want to know about Hands of Hope before we close out?
I would just say, you know, if anyone knows of any, the fact of the matter is that there's at least 10 to 12% of Henry County residents that are uninsured,
Right.
and you know, there's a good possibility that you know somebody that could benefit from the clinic. So just getting the word out, that's one of the main things we're trying to do, is let more people know that we're here and here to help.
That's great. Well, Chair helps us do that.
Yes.
So we're going to make sure that gets out. Well, that's been a wonderful Henry Talks. Thank you for being here.
you so much.
Chair, thank you for bringing this to us and coordinating the interview. I want to thank everybody who participates in the Hands of Hope and the kickball tournament. So please get with Hands of Hope with the clinic, sign up, bring your team, see if you can win. Probably not against the Water Authority. I don't know, maybe. We'll see. But thank you very much for listening and watching, and we will see you next time on Henry Talks. Thanks.